So it's really an honor for us to have the next panel of speakers here. And we are incredibly fortunate to have former Congressman Patrick Kennedy to moderate this panel. Both as a former member of Congress and as a private citizen, Patrick has worked as a tireless advocate for improving public health. Among his many accomplishments, Patrick was the author and lead sponsor of the Mental Health Parity and Addiction Equity Act of 2008, which is responsible for providing tens of millions of Americans who were previously denied access to care, appropriate access to mental health and substance use disorder treatment. And today we are proud to call him a partner in our efforts to address substance use disorders and the stigma still attached to addiction. So with that, I'll turn it over to Congressman Kennedy, who will introduce and moderate our next panel.
Thank you, Michael.
Thank you.
Thank you very much, Michael, and it's an honor for me to be here with all of you this morning. I thank all of you for the work that you do in this field, and I'm honored to be part of this. So I'd like to have Dr. John Kelly and Walter Ginter and Neil Kaltenaker. Kaltenaker, okay. Thank you for joining us for this final discussion, a panel on kind of the elephant in the room as we understand it in this world, and that is the denial. The denial that's so pervasive that it keeps us as public policy people, treatment advocates, consumers, from actually doing what Director Kurlikowski so eloquently pointed out at the beginning of this forum, and that was to do what we know works. We are held hostage by this thing called stigma. And I can speak to it both as a person who struggled with addiction, but also struggled with the secrecy that I used to try to hide this medical illness that we had the NIDA medical experts from the National Institutes of Health also brief us about this morning. So why was it that my illness, an illness that I couldn't tell anybody about, why is it that my illness, and I might add, you know, you saw this title, Anonymous People. I'm not a very anonymous person in recovery, okay? When I got into recovery, I'm also someone who's been to drug court. So I appreciate all those who talked about their experience in drug court. I did have a year of uninterrupted sobriety thanks to the fact that I too was at the D.C. Superior Court going every week to be monitored. But ultimately for my recovery, it took me, as they say in the movement, it took me having to change almost everything in my life before I was able to get really coming up on 3 years this February 22nd in sobriety. Now, I was afraid to ever talk about my sobriety date because it constantly changed, right? Because I could stop, but I could never stay stopped. And that is what we're here to talk about, is this is a chronic illness. But just to give you an anecdote about how big our problem is, I went with a new doctor because I moved to a new community and to be with my wife, and now I have 3 kids. And I was starting with this new doctor closer to home, and I would say I'm pretty well known. And there were several articles about my work in mental health and being in recovery. And do you know, in my medical exam 3 weeks ago, that my doctor did not ask about my mental health and about my recovery? Now, no shame on that doctor. That doctor, as we've heard in earlier panels, is not in a system called healthcare which acknowledges this illness. So what we hope to hear from this panel is what are some of the systemic things that we can do to help change this. And I think first and foremost, as you've heard from Pat Taylor and others, this is a multidimensional campaign, just like my recovery is multidimensional. I have a physical allergy, a mental obsession, and a spiritual malady. So when all of you are talking about integrating, the criminal justice system with the healthcare system, with community support systems, it is a necessity for those of us in recovery that everybody talk to each other. And so I appreciate the fact that the White House has convened this. Director Kurlikowski, I thank him for his leadership once again. I thank Michael and David for their leadership in ONDCP. But this panel is to discuss these issues of stigma and how do we address them. Because as we were charged to do at the beginning of this forum today, knowledge drives what we do, said David Mineta. And so what we need to talk about today is messaging also drives what we do in this country. And the knowledge that we're talking about today doesn't equate the messaging that the people in this country are getting from what we're talking about today. Okay? So what I mean by that is even our good friends from Colorado could not talk about the elephant in the room, which is that we're marching down a road towards changing the attitudes towards legalization of drugs. And what is the impact of that change of attitudes? Well, I go back to our director of NIDA and his slide, which shows that a perception of risk correlates to use rates. So when the perception of risk is such that, oh, it's no big deal, then guess what? More people use, especially those who are our youngest, who are impressionable, and for whom the messages that we heard from all the panels before us are, do as I say, not as I do, which of course we know is not an effective message. So I was going to ask our expert doctor, don't you think Uncle Sam needs an expert? In other words, we need some prevention policy when it comes to how as a nation collectively we address these subjects. Because if we're going to follow the charge of ONDCP, we need to do what our knowledge tells us works. And if our knowledge says, well, we don't want to incarcerate people, amen, because I don't believe that that is the way out of this problem, as was said all morning. But if our knowledge also says that when we implicitly send messages through this movement towards legalization, that more people are going to end up using, thereby putting more people who, like myself, had a predisposition to addiction to becoming addicted, then what are the implications of that policy and how do we right-size that policy such that we're not adding insult to injury by saying, oh, we're going to not incarcerate anybody any longer, but we're going to adopt a public policy that's going to lead more people to end up in the throes of addiction just because of the permissive environment that we're setting up whereby we de-risk the perception of harm towards drugs. And as you know, I'm talking about marijuana. So I'd like to first address Walter Ginter, who's the project director for medication-assisted recovery support. He's been one of the country's leading advocates of medication-assisted treatment for opioid addiction over the past decade. He's been in recovery for more than 30 years. And Walter's met advocates from all over the country, and he's also been a leader amongst that community. And his initial response was, why did I have to go through 20 years feeling miserable about myself because I couldn't get off methadone? And after I got over my anger, I did not want others to go through what I did, and that's why I became a patient advocate supporting recovery. So I'd like to start by having Walter explain how recovery comes in many forms, and thank him for presenting on this subject.